Since our last update, I'm pleased to inform you that today we have registered the highest number of people who have recovered from the disease. We have discharged 32 people from hospital. This now brings to 239 the total number of recoveries from COVID-19. These recoveries indicate that it is possible to overcome the disease with proper management. This number of patients discharged could not have been possible without the dedication and commitment of our health workers, some of whom work under very difficult conditions. We want to take this opportunity to thank them and salute them for their work on the front line. As we said earlier, recoveries happen all the time from COVID-19. If one is infected with COVID-19, it is not a death sentence. Most people do recover from COVID-19. And since this is a new disease, this group of people who recover from COVID-19 continue to make substantial contribution to the knowledge on COVID-19. Fellow Kenyans, since yesterday, we have tested 1,056 samples collected from individuals in quarantine facilities and from those in the surveillance program. Out of these, 23 tested positive for COVID-19 disease. 22 of them are Kenyans and one is a Burundi national. The cumulative number of those who have tested positive in the country now stands at 672. The overall number of samples that have been tested in the country to date is 32,097. The distribution of the cases by counties is as follows: 12 in Mombasa, 6 in Mandera, 4 in Nairobi, and 1 in Kajiado. 20 of the cases were picked by surveillance teams, while 3 are from the mandatory quarantine facilities. In Nairobi, the 4 cases are from the following estates: 2 from Umoja, 1 each from Komarok and Pipeline. The 12 cases in Mombasa are from the following localities: 2 from Kisauni, 2 from Likoni, and 8 from Mvita. The 6 cases from Mandera are distributed as follows: Mandera East 3, and 1 each from Elwak, Mandera North, and Mandera West. In Kajiado, the 1 case is from Saina Estate. In terms of age, the cases range between 1 year, 9 months for the youngest, and 80 years for the oldest. By gender, 13 are males, while 10 are females. I'm also saddened to announce that we have lost 2 other patients from Mombasa. This now brings the number of those who have succumbed to the disease to 32. I want to send our condolences to the families and friends of the disease.
In the hospitality sector and the tourism sector, we want to gradually open this sector as well, because it is worstly hit by this pandemic. The protocols, the ones which have been announced by the Ministry of Health, how practical, how effective would they be? But we have to respect those measures of social distances, the issue of washing of hands, the issue of stopping the spread of this disease to even clients and people who visit our establishment. So tomorrow we are starting with the hospitality sector. But we have agreed also, every sector will come with protocols that will be endorsed and agreed by the Ministry of Health. So the Ministry of Health will be the final endorser of these protocols, and when we roll them out, we must respect those protocols. And we must not only police them, the policing cannot be done by government alone. The hospitality industry, for that matter, must find a mechanism of policing themselves. Because if things go wrong, the hospitality industry will be blamed for spreading the virus to more Kenyans, and that is what we don't want. So government is committed to slowly and gradually opening the economy, and we want to establish the protocols ready. If not now, even in the new norm when the economy is open. So today I'm here announcing that we will formulate those protocols of the economy and slowly working with the stakeholders to make it work. So mine are those. And I want also, because I'm here also as a Muslim and it's the holy month of Ramadan, it's very important for us. It is the saddest thing to have the month of Ramadan without going to the mosques, without praying Taraweeh, without praying Tahajjud, which is coming. It is sad. But if this plague has to affect human beings, then even our religion have accepted we can postpone these activities. Today you have seen the Holy Mosque of Mecca, the Holy Mosque of Medina. They have shut down their gates because they know it can be a center where the spread can go to many other people. So that is something that we are not very comfortable with as Muslims. But my brothers and sisters who believe in Islam and are fasting, please, when you break your fast, don't mingle in crowds, because that can be also doing the spread of the virus. Those rituals and those traditions that we used to do of common eating in one plate, common feasting as a group and events, I think we must not continue with those rituals and those traditions, because they will affect the health of our colleagues and spread to the beloved ones, friends, and Kenyans.
I want to share an experience of our first COVID case in Isiolo, which I think is going to be a lesson or a learning to other counties and how not to do certain things, because our first patient was exposed to a lot of embarrassment because his photos and the photos of his family when we put them in quarantine was taken and put on social media, and that has brought a lot of embarrassment to him and his family. And I think there was a lot of excitement and a lot of concern, because a first case in the county, everybody is very much attentive, but that was not how to do it. And we want to urge other counties, especially those who may be getting their first cases in future, to make sure that the privacy and the privacy of the patient and his family or their families should be of paramount importance, because nobody is free from getting COVID. We are all bound to get, even if we are governors or cabinet secretaries and anybody, media. This is a disease that anybody can get, and therefore the issue of stigmatizing those who have the disease, the issue of looking at them like they have a mistake or they have a problem different from other people, it should not be entertained in any county. And I would like to take this opportunity actually publicly to apologize to our patient and his family, and also to ensure that people refrain from publicizing the identity, putting the name, the ID number, the photos, taking photos maybe as samples are taken and then that is flashed on social media. That is very negative way of handling this disease. In fact, it's counterproductive to the way this disease should be managed.